So it's early morning in the office. You and one of the other co-workers have arrived early, but suddenly that co-worker collapses and they're like clutching their chest. Now you're the only one who can help them. How are you going to respond to this situation? Now, if you came across someone lying on the ground, unconscious or unresponsive, would you know what to do? Every second counts in an emergency, and knowing how to respond can actually mean the difference between life and death. That's why every Australian should know the doctor's ABCD protocol. Now, this is a simple, effective approach to first aid that can guide you through those critical minutes before professional help arrives. So let's break it down. Now, D is for danger. Before rushing in, stop, look, think. The very first step is to check for danger. That means checking the area for anything that could harm you, the person, or any bystanders. Now, these dangers aren't always obvious. At a car crash, it might be like leaking fuel, live power lines, or maybe even broken glass. But in other situations, dangers can actually look pretty different. In the home, it could be a fallen power cord, spilled water, or on a work site, it might be like heavy machinery, unstable scaffolding, or maybe even airborne chemicals. In a public park, dangers could include aggressive dogs, exposed syringes, or even something as simple as passing foot traffic that you could trip over while you're helping. Remember, your safety always comes first. If you're injured too, how can you help anyone else? Ask for response. Now, once it's safe, check if the person is responsive. Kneel down and speak to them clearly. What's your name? Can you hear me? Open your eyes if you can hear me. Now, what we're looking for is any kind of sign of consciousness, like eye movement, a moan, a groan, or even a squeeze back. Now, if there is no response, move on quickly to the next step. S is send for help. So now it's time to actually get the help. If you're alone, call 000 right away. If there are others around, you can ask someone directly. Now, when you call, make sure that you're putting your phone on speaker. This allows you to continue caring for the person while also speaking with the emergency operator. Now, these emergency operators can guide you through CPR if needed. In remote areas or where signal is poor, you can also text 000 through the Emergency Plus app, which sends your GPS location to emergency services automatically. A is for airway. Now we can check the airway. Gently tilt the person's head back and open their mouth. Look for anything blocking the airway. So this could be like, food, vomit, blood, or even like some foreign objects. If you see something, make sure you roll them onto their side. This is called the recovery position, and gently scoop it out using 2 fingers, being careful not to push it any deeper. Now, a blocked airway is going to stop oxygen from reaching the lungs, and then eventually the brain. So clearing it really is vital before we move on. B is for breathing. Now that the airway is open, we need to check if they're still breathing normally. Make sure you put your ear close to their mouth and nose. Look, listen, and feel. Can you hear breathing? Can you feel breath on your cheek? Is their chest rising and falling? Now, we want to do this for no more than 10 seconds. Now, if they are breathing normally, continue to monitor them until help arrives. But if there is no breathing, or if the breathing is like irregular or gasping, now it's really time to act. C is for CPR. Now, if the person isn't breathing normally, you want to begin CPR straight away. Place a heel of one hand in the center of their chest, put your other hand on top, and keep your arms straight. Now begin compressions hard and fast. Give 30 compressions at a rate of around 100 to 120 beats per minute. That's roughly the rhythm of Baby Shark, if that's more your tempo. Press down about 1/3 of the depth of the chest. Yeah, you might hear ribs crack. That's not uncommon, and it's not a reason to stop. You can fix ribs, but you can't fix dead. After 30 compressions, give 2 rescue breaths. Tilt the head back slightly to open the airway, pinch the nose, and seal your mouth over theirs. Blow gently but firmly, wedging for the chest to rise and fall. Then we're going straight back into compressions. Now here's something really important. Rescue breaths are still taught in Australian first aid courses. But if you don't feel comfortable doing them, or you're unsure, hands-only CPR is the way to go. The Australian Resuscitation Council says, any attempt at resuscitation is better than no attempt at all. So if in doubt, just keep pumping the chest until help arrives, or until it's unsafe for you to continue. D is for defibrillator. Now the final step is to defibrillate, and this step can be a literal lifesaver. If there is a defibrillator available, also called an AED or an automated external defibrillator, grab it or have someone else bring it to you ASAP. AEDs are now found across all public places in Australia, like gyms, schools, shopping centres, community centres, workplaces, airports, and even some sports fields. And don't worry, you don't actually need any medical training to use one. Just turn it on and follow the instructions. The machine will assess the person's heart rhythm and only deliver a shock if it's actually required. You can't actually hurt someone using a defibrillator. Now, modern AEDs even tell you when to resume compressions and beep in time with the correct CPR rate. Now, if you're ever unsure, just follow the prompts. These machines are designed to be foolproof and fast. Now that's the doctor's ABCD protocol. D is for danger. R is for response. S is send for help. A is for airways, B is for breathing, C is for CPR, and D is for defibrillator. Now, learning this simple sequence could make all the difference in an emergency. At First Aid Pro, we don't just teach you the theory, we prepare you for the real thing. In our nationally accredited courses, you'll learn CPR, wound management, bleeding control, choking relief, and so much more. Now, whether this is for work, volunteering, or simply being ready to help a loved one, we believe that everyone should know how to save a life. Visit firstaidpro.com.au to find a course near you and get certified today.